morning. My presentation is on mental health. So we're going to start off with an activity, then I'll talk about mental health and mental illness, the history, I'll give the prevalence, so some data, the emotional implications, the programs that I've studied and critiqued, and then looking forward. So the activity that I would like you to do this morning is the 3 good things. So what I would do in a classroom setting is to number the students off and make sure that they've got a partner. So I would ask them to share 3 good things that have happened in their lives. They would think about this, share it with their partner, and then I would ask if they were comfortable to share with the class. So the whole idea of this activity is to build the relationships among the students and also with the teacher. So building that trust, building a really good, respectful relationship is pivotal to what I'm talking about in my presentation. So this activity comes from Reach Out Australia, and you can find those in my resource list at the end. So why don't you have a go now at just brainstorming 3 good things that has happened in your life. So now that you've brainstormed those 3 good things, I'm going to move on to the rest of my presentation. So, mental health and mental illness. Aboriginal health does not mean the physical well-being of an individual, but it actually refers to the social, emotional and cultural well-being of the whole community. So for Aboriginal people, this is seen in terms of the whole life view. So a holistic approach is what we're looking at this morning. So the World Health Organization defines mental health as a state of well-being which encompasses these major characteristics. So an individual recognises their own abilities, they can cope with the normal stresses of life, they can work productively, and they can make a contribution to their community. So Helen Milroy was an Indigenous psychiatrist, and she developed these themes that were coming from the history of Indigenous Australians. So these were the denial of humanity, the denial of existence, and the denial of identity. So the significant amount of stresses affecting young Aboriginal and Torres Strait Islander peoples currently are seen against the historical background of the negative impacts on their health, culture, and society. So these are considered vulnerability factors, and they can continue into further personality dysfunction. So some data on mental health in Indigenous young people. So Aboriginal and Torres Strait Islander people currently experience poorer health outcomes than non-Indigenous people. So they experience higher rates of these health outcomes and at younger ages. Some significant stresses are more common among Aboriginal and Torres Strait Islanders than among the total population. In 2008, nearly 1/3, so 32% of Aboriginal and Torres Strait Islander people aged 18 years and over had experienced high or very high levels of psychological stress, which was more than twice the rate for non-Indigenous people. So despite the prevalence of mental health concerns, few access clinical services. So data shows that access to mental health services is reported to range between only 5 or 35% of children identified with health difficulties. So we can see here a significant need for education programs to be implemented in remote Indigenous schools to address mental health issues. Approximately 1 in 4 Aboriginal and Torres Strait Islander children and young people aged 4 to 17 years were viewed by their parents as being at high risk of significant emotional or behavioural difficulties, and less than 1 in 6 children and young people of the same age group in the general Australian population. So this is compared with 1 in 4, with 1 in 6. So you can see here that significance. So children of Aboriginal and Torres Strait Islander carers who had been forcibly separated from their families were more than twice as likely to be at high risk of significant emotional and behavioural difficulties, and had twice the rates of alcohol and other drug use than children whose carers who had not been forcibly separated from their families. So these findings indicate that although personality disorders are problematic categories of illness, due to historical, cultural and political factors, they cannot be ignored. So the cumulative impact of the trauma and the grief is really significant, and these require management strategies. So the higher the level of inequality within developed countries, the higher the rate of child and adolescent mental health problems. Between 2008 and 2012, the suicide rates of 15 to 19-year-olds was 5 times higher than the non-Indigenous rate. So we can see here that if the history of the mental health condition plays a part, also does suicide, relationship problems, death of family members or close friends, and also bullying behaviour. So you can see here how suicide is only actually playing such a small part in the whole problem here. So there are many aspects that need to be considered. So we're going to watch this video here, and it's talking about how racism leads to mental health problems in Indigenous Australians.
You're not staying there, right? What do you think she's up to? Could you really rely on her? Don't make eye contact.
Oh, excuse me, what about my change? And the Abo barman says.
Go on. It's only a joke.
Discrimination leads to depression and anxiety in Indigenous Australians. No one should be made to feel like crap, just for being who they are.
Some of the emotional implications of mental health illnesses could include dispossession of land, impacts of policies and procedures historically, socio-economic characteristics, housing, transport, behavioural factors, community capacity, and social and emotional well-being. Some of the external stresses could include serious injuries, illness or disability, higher levels of death in the family or community, overcrowded houses, and they could have trouble with the police being sent to jail. So these are all implications that could affect their mental health. So some of the mental health problems that impact social and emotional well-being include these 4 types. So the main types are anxiety disorders. So for example, panic disorders or post-traumatic stress disorder, PTSD. Mood disorders, which could be bipolar disorders as an example. Psychotic disorders such as schizophrenia, and substance use disorders. Other disorders that could impact on this as well includes grief and loss, trauma, self-harm, and suicidal thoughts or behaviours. So now I'd like to move on to the programs that I have studied. So this program here, Living Well, a strategic plan for mental health in New South Wales 2014 to 24. So under the New South Wales Government's response to this program, funding in 2017 and 18 will support enhancements to the Aboriginal mental health workforce and a new Aboriginal Got It team. So the New South Wales School Link Initiative, this is a statewide initiative funded by New South Wales Health, which is a strong collaborative initiative between Child and Adolescent Mental Health Service and the New South Wales Department of Education, which aims to improve the mental health and well-being of students in New South Wales. So, this is the program title. It's called Getting on Track in Time, Got It. Evidence suggests that Aboriginal children are more at risk of behavioural and emotional problems than their non-Aboriginal counterparts, especially given the many stress-inducing issues in their lives, which we've already talked about. Successful specialist school-based mental health early intervention programs like this one is actually being implemented specifically for New South Wales children in kindergarten to year 2, so the ages of 5 and 8 years old, and their parents or carers. It's adapted from Getting on Track in Time, Got It, so it's aimed to be appropriate and engaging for Aboriginal children and the community. So this program was originally piloted in Mount Druitt, Newcastle and Dubbo, and it was raised with the research that shows that conduct disorder responds well to intervention. So it's delivered by specialist child and adolescent mental health service teams with the New South Wales Department of Education. So training will be provided to 800 teachers and school staff to increase the capacity to deliver a range of interventions to respond to the mental health needs of children with challenging behaviours. So, what does it look like? These Got It teams work closely with the school staff, children, parents and carers, and also local service providers. So it's conducted across 2 whole school terms, and it consists of an initial parent and teacher screening for the emerging conduct problems. So these need to be identified. Voluntary participation follows this, and it's over a 10-week period, so it's a targeted clinical program. It is supported by whole of school intervention and specialist assessment and referral for individual needs. So the National Aboriginal and Torres Strait Islander Health Plan 2013 to 2023 includes some of these strategies. So they will continue to implement the Roadmap for National Mental Health Reform, the National Aboriginal and Torres Strait Islander Suicide Prevention Strategy, and the renewed Aboriginal and Torres Strait Islander Social and Emotional Wellbeing Framework. There will be continued support for counselling, health promotion and early intervention services to promote social and emotional wellbeing, including members of the stolen generation. So, in my research, I have revealed a significant need to work as part of a multidisciplinary team when dealing with this issue. So, mental health professionals need to work in a multidisciplinary team, and this is outlined in the National Practice Standards for the Mental Health Workforce. These standards were first developed in 2002 and again updated in 2013. The National Mental Health Strategy was developed from this. So 6 of the key principles outlined in this strategy have an emphasis on positive consumer outcomes. They also have consumer participation in decision making, which is really important. And the last one here I would like to outline is the multidisciplinary service delivery. So many different health professionals working together for the health of the community and the individual. I'd like to also mention here that the workforce education and training is a vital component of mental health, and I've noticed in my research with the programs that are implemented, they actually bridge the gap between school and then life beyond school in the workforce. So one other strategy that I'd just like to add on for your resource is Mind Matters, and it's a national mental health strategy for secondary schools. So this consists of modules that actually allow a school to tailor its needs as appropriate. So they can develop their own mental health strategy depending on the students that attend, what their needs might be, and maybe for the different cultures that are represented at that school. So just a summary of what my findings were with the multidisciplinary approach shows that there's a mounting evidence to show that there's collaborative, interdisciplinary, client-centered practice being the best approach to addressing this complex and varied health need. So there needs to be an emphasis on linking mental health services with the broad range of other health services and welfare services used. Also, a focus on prevention and promotion, partnerships among service providers and consumers, and on population health principles. So, the mental health policy and practice needs to be informed by a deep understanding of context, not just epidemiological evidence or data, and must therefore involve community development. So understanding the context is really important in developing these programs. So looking forward, the improvement in Aboriginal and Torres Strait Islander people's social and emotional well-being requires effort from all levels of government across all sectors. At the local level, they need to be supported by services and programs that promote child development and effective parenting which foster healthy and resilient children. Initiatives that promote connections to languages and culture will result in strengthening of communities. In a state level, they need to promote links across mental health and drug and alcohol services. They need to increase community awareness about education among the range of options for dealing with the impact of drug, alcohol and tobacco use, and strategies to prevent the harms caused by violence, self-harm, abuse, promoting resilience, empowerment and positive mental health. This one here is talking about the wellbeing workforce. If we aim to build this, it will have a multidisciplinary or collaborative approach among school and the workforce. We need to reduce the overrepresentation of Aboriginal and Torres Strait Islander people in the criminal justice system through this framework here, the National Indigenous Law and Justice Framework. This will significantly improve mental health among young Aboriginals. In summary, it is not a straightforward process or an issue, and it's going to be multifaceted, including a range of different approaches. So we need to solve these issues, keeping in mind the socio-economic, educational disadvantage and racism. These play really important roles in the mental health of these young people, which that video really exemplified. Programs which target adolescents and their parents and carers, as well as programs which promote resilience in primary school, is really important. So using these programs in addition to each other, not instead of. These programs need to be flexible so that each school can adapt it to suit their needs. Promotion about mental health in all cultures nationally. So this isn't just in young Aboriginal Australians, but it would be good to see it as a national approach. All healthcare professionals must assess the community and the individual using a holistic approach. So up the top here you can see that in holistic education we're actually focusing on the whole child, not just one aspect. Same in the holistic approach with this mental health issue. We need to be focusing on the individual and the community in a wider, bigger picture. These here are my references which you can look at, and they're also on my activity sheet or handout that you can find on Moodle. Thank you for watching. I hope you've learnt something from my presentation. Feel free to ask questions on the forum as well. Thank you.